In many ways, Matthew is a typical 12-year-old. He loves video games, basketball, and his dog Maddie. But there is something different about Matthew. He describes it as an internal voice focused on his fears.
What's the name you gave it?
Mental convincer.
The mental convincer?
Yeah.
What was the voice saying?
What if I wanted to hurt myself or something like that, and then I started getting really nervous and I didn't know what to do, and then the thought just kept on rolling and rolling in my head.
Matthew has obsessive compulsive disorder, or pediatric OCD, a brain disorder in which obsessive thoughts lead to extreme anxiety and compulsive behavior trying to reduce that anxiety.
I used to have to keep my chair in and facing myself, or else I couldn't sleep. So when I'm going to sleep, it had to be like this, always. And with the door, I used to have it all the way open. I did it because I felt like it just had to be that way, or else I just couldn't function in the day or go to bed.
He had trouble separating fantasy and reality, and that scares him, and rightly so, because you feel like you don't have control of your mind.
There are an estimated 500,000 children and teenagers who have OCD. That's about 1 in every 200. The same number of children who have diabetes. And oftentimes it's genetic, particularly when it starts in childhood.
I had OCD as a child, and I still have tendencies toward it as an adult.
OCD affects not just Matthew, but the whole family.
It was hard on the household because anywhere someone was watching TV, if he saw something that scared him, he would pick up on it, and then it would affect him for the rest of the evening.
Do you think you could have handled this without therapy, without outside help?
No, absolutely not.
I think about it a lot like a medical disorder, like asthma or like high blood pressure, that can effectively be managed and can effectively be treated, even if it's not fully cured.
Dr. Anthony Pugliafico is a psychologist who specializes in treating pediatric OCD like Matthew's with an intense behavior modification therapy called cognitive behavioral therapy, or CBT.
It really involves gradually guiding the individual to face the types of situations that bring up obsessions and are, in turn, anxiety-provoking, and helping that individual, helping the child to resist compulsions in those situations.
Matthew's therapy includes daily charts that limit and even eliminate his compulsions.
I have one for washing my hands at the time that I'm supposed to, which is before I eat.
According to the International OCD Foundation, cognitive behavior therapy is extremely effective, resulting in as much as an 80% decrease in OCD symptoms. But because it is so demanding, about 1 in 4 OCD patients refuse to do it.
As much as their OCD might be impairing their lives, the idea of changing, the idea of facing these fears is terrifying.
Dr. Pugliafico and a research team at Columbia University are studying the brain to better understand causes of OCD and how various drug and behavior therapy combinations can improve treatment.
Do you see a different child now?
Yeah, definitely. It's freed him from some of these things that he couldn't do to doing so many things that he loves to do. I feel a lot happier, and I feel a lot greater that I don't have to just deal with all these thoughts every day. And even though I feel a lot better, they're still gonna come up, and I'm gonna know how to handle them.
And you can just be a kid, right?
Yeah.
And that's important.
Day by day, Matthew is learning to silence the voice in his head and his fears. Lisa Rudolph reporting.